Thank you for tuning in to Amaris B podcast. I am Dr. Ivan Puah, and I founded Amaris B Clinic in 2004. I am an MOH accredited liposuction doctor and medical aesthetics doctor based in Singapore. I have been trained directly under Dr. Alfredo Hoyos and Dr. John Millard for basal liposuction, Dr. Pierre Fournier for liposculpture, fat grafting, and thread lift. Also by Dr. Delgado for dedicated surgical training in gynecomastia surgery in San Francisco. Okay, today we have a guest. I'll let her introduce herself.
Hi everyone. Thank you for having me, Dr. Puah. Thank you for listening to Amaris B podcast, everyone. I'm Bianca. I'm part of the Amaris B marketing team. So I am here today to ask Dr. Puah some questions that are frequently asked by our followers in our DMs so that we are able to separate facts from fiction. So the first commonly asked question, Doctor, can I begin?
Yes, please do.
All right, so the first one, are there any natural remedies for gynecomastia?
Unfortunately, there is no natural remedies for gynecomastia. Gynecomastia has to be treated medically or surgically.
Ah, okay. How about aging? Can aging cause gynecomastia in men?
Definitely. Aging can cause gynecomastia, especially for aging men if they gain weight, if they're on medications, any changes in their hormonal levels, imbalances, and so on and so forth. Yes, they can.
Right. So this one is a favorite question of mine because sometimes I see articles saying it can, sometimes the article says it cannot medically. Medically, right? So medically, can beer or food containing soybeans cause gynecomastia, giving you male boobs?
It's a commonly asked questions. The answer is yes. If you consume too much beer or soybean meal, leading to weight gain, it definitely can lead to gynecomastia. However, if you ask me whether beer itself or soybean milk itself can lead to gynecomastia, in practice, it's very difficult. It's not easy to lead to that.
How about soya bean in itself? Like, in Singapore, we love to eat a tahui, right? Like, soya bean, the bean itself,
Well,
and not the milk. Is there any difference to it?
soybean products or soybean milk contains estrogen-like elements that may stimulate the growth of breast gland tissues. But in practice, you need to consume a lot of these to have any effect on that. In real life, in practice, we don't do that by drinking 1 or 2 cups a day, 3 meals a day. It's unlikely to lead to any changes.
So it's a myth. Beer, soybeans, eggs, no matter how much you eat, because nobody eats in crazy amount, can give you gynecomastia, right?
Yes, that's true. It's a myth.
Okay, that's great. Everyone listening to this, beer, soybeans, or egg, or any animal product food cannot give you gynecomastia because nobody would eat in crazy amounts. Thank you, Dr. Paul. So I'm gonna have more questions for you, okay? So diet and exercise, can they get rid of gynecomastia?
Diet and weight loss can reduce body weight and total body fat percentages, which may affect how the breast size or shape may look like. But it's unlikely to improve or resolve gynecomastia, which is caused by enlargements of breast gland tissues. So there you go.
So weight loss, fat loss, diet or exercise cannot get rid of gynecomastia because they don't affect the glands at all, right? It has got no relationship with the glands.
Yes, the true cause of gynecomastia is due to enlargements of increase in breast tissue, not
Mm.
due to any difference in fat layers at all. So weight
Mm-hmm.
loss, dieting, it's unlikely to resolve true gynecomastia.
But can chest exercise reduce the appearance of it?
Yes, you can. If your chest is more sculpted, it's leaner, it may look different, provided your breast glands is not bothering you or it's not thickened or enlarged.
So how can gyno be prevented?
Gynecomastia cannot be prevented in most instances because the cause of gynecomastia for patients who suffer from physiological gynecomastia is due to the imbalances in the hormonal level when they are growing up, let's say, for example, for teenagers, or when they are aging, for example, in middle-aged men. So you can't change those things. Things that you can change, for example, things that you can affect or change is to treat or prevent any pathological causes
that leads to gynecomastia.
Mm. So can gynecomastia be treated with liposuction alone, or can it only be removed via gynecomastia surgery, or both, or how does it work? So this is another common question from our followers on Instagram.
Liposuction alone cannot effectively treat gynecomastia because for most patients, gynecomastia is due to fat accumulation with enlargement of breast glands. So liposuction cannot remove the enlarged or excess breast tissue. On top of liposuction, most patients will require a surgery to remove the enlarged breast tissue as well.
So if the patient wants to leave his gynecomastia alone, is that okay too?
Yeah, if you're comfortable with it, if it doesn't affect you, you can leave it alone because it is benign. It won't lead to anything.
But it may grow bigger, right?
Yes, it may. If you gain weight when you age, if you're on certain medications, or if you suffer from certain medical illnesses, yes, it may.
But can it go smaller?
No, it's unlikely to grow smaller.
So gynecomastia cannot go away on its own as an adult, right? But for babies, I hear that you have shared with us before on one of your podcasts that for babies or adolescent, it may go away on its own.
For babies, or what we call neonatal gynecomastia, they don't require any treatment and their condition will usually resolve by itself. For teenagers, what we call adolescents gynecomastia, a certain amount of patients will have spontaneous recovery and the condition usually will not last beyond 1 to 2 years. For those who have those conditions for more than 1 to 2 years, very likely they will require medical intervention.
I see. So, for some teenagers, it will go away, but for some, no, right? There's this parent who actually sent us a DM asking how to know if her son, her teenage son, is suffering from gynecomastia, and she's asking how does she provide support and how can she tell? Because she suspects from our blog posts and articles, she looks at it and she kind of like suspects it. But I think she sounded really very concerned and she was asking how can she help him?
Yeah, this is a very common problem faced by families. For most patients, for most men that suffer from gynecomastia, to them it is a very personal problem. They feel embarrassed by it. They don't often share it even with the family members. So a lot of parents, a lot of spouses, they are not aware that their children or their spouse are suffering from it. Very often, the patients will present with symptoms of depression, social withdrawal, lower confidence. And unless you talk to the patients and kind of like discuss, and hopefully the patients will open up to you, most patients do not share their stories or their sufferings with their family or friends, unfortunately.
So do you have any advice for the mother?
My advice to the mother is if she noticed a physical change in the son, such as he started to slouch a little bit more, opting to dress up in baggy clothes, and a change in behavior, being more withdrawn, feeling depressed, having social phobia, and complain to you that he feels uncomfortable when he's exercising or pain in the chest, then she should sit down and talk and understand more from the son what's bothering him, and to let her know that this issue can be resolved, and seek a doctor's opinion to assess and to find out what's bothering the son.
Yeah, I think during this stage, for teenagers, it's not easy going through everything, right? So, as parents, when our child is like misbehaving a little bit out of the ordinary, we might take it personally. As parents ourselves, we might take it personally, like, why you rude to me? But actually, it's the kid that's going through certain things, and it's important to have an open communication.
Yeah,
I
that's
like your
right.
advice, doctor. Yeah. So going to gynecomastia surgery, right? The topic of the surgery itself. There are a few common questions, such as can it be performed with other procedures? And can gyno surgery only be conducted by plastic surgeons?
Gynecomastia surgery can be conducted at the same time with other surgery. The common request I often get from my patients is to have the surgery done together with liposuction of the tummy, face, the waist, and so on. Because, well, to them, since they are under anesthesia under surgery, then they might as well have liposuction at the same time to make them feel good as well.
That makes sense, right? So after you make your top looks good, you can also work on the other areas. So you just go through the surgery one time and wake up looking and feeling really, really a lot better.
Yeah, that's right.
Yeah. So next question would be, how long does the surgery take, and is gynecomastia a complicated procedure?
Gynecomastia surgery is what we call a minimally invasive surgery. It can be conducted under local anesthesia with light sedation. Patients often do not need to undergo general anesthesia at all. This reduces the risk of surgery, the risk of anesthesia, and they can recover very well, hopefully returning to their home within 1 hour or two after the surgery.
Yes, gynecomastia surgery is a simple procedure for the patient, but not everyone can do gynecomastia surgery in Singapore. But in the same breath, gynecomastia need not be performed by plastic surgeons. Am I right, doctor?
Oh, yes, gynecomastia surgery actually involves more than just removing the glands, because beyond treating your gynecomastia surgery, we have to make you look good. Most of the patient that comes in for treatment or seek consultation is often bothered by how their breast looks like. And of course, the underlying cause and issue is gynecomastia. But my job as a surgeon is not only to treat and resolve the gynecomastia, but also help them to look good. Gynecomastia surgery is not as simple as treating the enlarged glands. To me, gynecomastia surgery involves four aspects. First is to remove the excess enlarged breast glands. Second is to remove any added fat layers that make your chest, your breast looks round and big. Thirdly is to shape and enhance your musculature to make you look toned and athletic. Last but not least is to do what we call surgical tightening, to help you tighten your skin, improve your skin texture, and make you look normal and natural as well. Gynecomastia surgery does not need to be performed by a plastic surgeon. It can be performed by a breast surgeon, a normal surgeon, or anybody who has license to perform liposuction.
So, doctor, after the gynecomastia surgery, right, will the enlarged male breast come back?
No, any results, any improvements from gynecomastia surgery is permanent. You cannot grow back your glands, nor can you grow back the remove fat layers as well.
Ah, I see. So can only overweight men get male boobs?
No, overweight men has higher risk of developing gynecomastia, but we do see skinny men, skinny teenagers coming in with gynecomastia as well. It doesn't mean that you will get gynecomastia if you are overweight. It's just that you have higher risk of developing gynecomastia if you are overweight.
I see. And a question that is commonly asked, right, is that a lot of men have the impression that male breast, although it's very common, it's a common occurrence, they thought that it is an early sign of breast cancer. It's not, right?
No, gynecomastia is not an early sign of cancer. Breast cancer is very rare compared to female. Having gynecomastia does not mean that you have breast cancer or increased risk of breast cancer.
Is it a sign of andropause?
It is a sign of andropause, as aging men often have imbalanced hormonal levels, which could lead to increased risk of developing gynecomastia.
How much does gynecomastia cost in Singapore, and is it MediSave and insurance claimable?
Gynecomastia surgery cost varies. It will depend on the severity of your condition, the experience of a doctor, the facilities for the surgery, investigation, consumables, and post-treatment follow-ups as well. So it's best for you to seek for doctors who are experienced in treating it. Gynecomastia is a recognized medical condition. For most cases, you can use your medical insurance and even MediSave to defray part of your costs. However, you need to check with the service provider and insurers to know more about this.
Thank you, doctor. That was very helpful. Last question for the podcast today is, what should I expect after my gyno surgery procedure?
After the surgery, there will be a period of recovery where you're required to go back to your doctor for post-surgical follow-ups, for wound care, for swelling, for pain management, and so on and so forth. After surgery, for most patients, they are able to resume close to 80 to 90% of their daily activities, including work, social, family activities within days. However, I would not recommend any water activities or gym exercises before 1 to 2 weeks after your surgery.
Thank you for the very helpful answers, and I hope that this would help our future patients or even current ones answer all the things that they see online and to know that not everything you read online is true. If you have any question, just simply let us know. Send us a DM or just send us an email or even just WhatsApp us, using the clinic number.